Now, 7 American humanitarian workers are currently under precautionary Ebola quarantine in Kenya after returning from the Democratic Republic of Congo, where they helped respond to the ongoing outbreak. Now, while none has tested positive for the virus, the arrival has renewed questions about Kenya's preparedness should Ebola cross the border. KTN spoke to infectious diseases physician Dr. Duncan Nyukuri at the largest referral hospital in Kenya, KNH, who says the country has spent years preparing for exactly that possibility.
The arrival of 7 American aid workers under a 21-day Ebola observation period has once again put Kenya's preparedness under the spotlight. Although the humanitarian workers are healthy and have not tested positive for Ebola, health experts say the situation highlights the importance of remaining vigilant as neighboring Democratic Republic of Congo continue to battle the world's largest outbreak of the Bundibugyo strain. According to the infection disease physician Dr. Duncan Nyukuri, Ebola is not a new threat to East Africa.
It's a disease that is normally found in wild animals. Bats are the animals that we suspect are what we call the reservoir. A reservoir is something that will harbor this disease, but the disease won't kill them. So in bats, it's basically, it doesn't kill them, but the Ebola virus multiplies or replicates in them without killing.
Dr. Nyukuri explains that the virus currently driving the outbreak is the Bundibugyo strain, first identified in Uganda and one of the least studied forms of Ebola. Unlike the better-known Zaire strain, which has licensed vaccines and treatment options, Bundibugyo still relies largely on experimental vaccines and clinical trials.
There are various strains. There are actually 5 strains. There's the Zaire, that is the one that's found mostly in the Zaire region. Highly infectious, pretty deadly. But the good thing with the Zaire strain is we have a vaccine and potentially some treatment options that can be used.
Despite the regional outbreak, Kenya has not recorded a confirmed Ebola case linked to the current epidemic. Health officials say preparedness efforts are focused on training healthcare workers, strengthening surveillance, and conducting simulation exercise to ensure hospitals are ready if suspected case is detected.
Carried a lot of training to healthcare workers, readiness assessment, going to entry points, simulating patients, a patient with Ebola, and the journey that they take from admission, from presentation to admission to treatment. So we have been doing all that, but simulated cases.
Uganda has already discharged its last Ebola patient and begun the mandatory 42-day countdown to be declared Ebola